So, Dr. Scholz, we just got back from ASCO GU 2020, which is a huge medical conference for men's health. And when it really comes down to it, is prostate cancer. And there was a lot of new medical findings that they had in clinical trials. Can you speak to what stood out to you?
Yeah, a couple of things. I mean, one of the things with these conferences is a lot of times they're just small incremental. We know this about hormone therapy, but we don't know is, treatment A or B better or worse. And so there was a lot of that sort of refinement studies. But one of the studies, or a couple studies caught my attention, were related to the advances that are happening in RNA genetics. We've heard a lot about genetics in trying to things that will predict cancer, or there are now studies showing that medications like olaparib and rucaparib can take men that have a mutation called BRCA and help the anti-cancer effects of that medicine. In other words, if men have a specific genetic mutation, that medicine will work better than when they don't. And so it's easy to identify these mutations now with a mouth swab or a blood test. And that has provided hope to bring a brand new treatment to the prostate cancer world. We have some very good treatments, but we can always use more. The RNA type genetics, however, in my view, is going to bring a whole new realm of understanding cancer and diseases in general. And there were two posters that I would just like to briefly mention. One was the head author was Dr. Laurence Klotz of active surveillance fame. And they came up with some RNA signatures that they test in the urine that seem to provide 99% accuracy for men that do and don't have prostate cancer, and 99% accuracy for the men that do have cancer, whether it's a Gleason 6 or lower or a Gleason 7 and higher. This is what we call the innocuous, harmless types of prostate cancer versus the consequential types that need treatment. So that is stunning data. I mean, our PSAs, as we know, are 30 or 40% accurate. The other tests like OPCO-4K and SELECT-MDx are, 40, 50% accurate. That's just not good enough. You need to either have knowledge of the cancer present or not present, or you're going to need a MRI or need a biopsy. So if that data pans out that Dr. Klotz produced, that will be a real big game changer.
How do you think that'll affect the biopsy process?
Well, if it's that reliable, conceivably, men won't need a biopsy. They may need a biopsy if they have the higher grade forms, but all the men that don't have cancer, according to this test, or all the men that have the grade 6 form of the cancer, according to this test, won't need a biopsy, which would be fabulous. We're talking about saving 700,000 men being biopsied every year. It'd be a total game changer. That same technology is also being evaluated by a company called Miradx, run by Joanne Weidhaas, and she's using microRNA mutation assessments to determine who is likely to get side effects from common therapies like radiation or immune therapy. And there are patterns, genetic patterns of people that are more likely to get radiation toxicity or more likely to get side effects from the new powerful immune medicines like Keytruda and Opdivo and those sorts of agents. So that would also be wonderful if before starting treatment we could know in advance who is likely to get side effects and who isn't. And then in the ones that are unlikely to get side effects, those people will, we can embark upon treatment with a real clear conscience and know that they're at least not going to be harmed by the treatment. So these things are early in development, but they look really exciting. And there's a lot of other stuff at the conference, improvements on MRI, PSMA PET scans are coming on strong.
Well, that's some amazing developments. We didn't have that 5 years ago, or even the hope of that. Well, they were studying it 5 years ago, but to have those type of outcomes, that's going to affect prostate cancer patients in the future in a huge way.
Yeah, it's interesting that prostate cancer, in some ways, is this sort of neglected cancer because medical oncology, as especially, only is involved in the advanced stages. But on the other hand, with PSA and these genetic tests and then better imaging, the progress seems to be advancing more quickly than it is in the other cancers.
If you would like to learn more about everything that Dr. Scholz just talked about, you should come to our conference on March 28th in Los Angeles, and that's March 28th, 2020, and we are going to be discussing basically microRNA, and I believe Joanne Weidhaas is also going to be there, and so she'll be able to explain that further, as well as imaging and advanced testing and advanced prostate cancer treatments. We hope to see you there. Thank you so much for watching. If you appreciated this video, go ahead and subscribe to our channel and hit the like button. This helps share this video across the YouTube platform for other prostate cancer patients. And if you have a question that you would like asked in the future, you can go ahead and leave it in the comment section below. For further questions or any information you need, you can visit us at pcri.org.